Let me ask you something honestly. If there were a few everyday habits quietly damaging your erections, reducing sensitivity, and increasing your risk of future sexual health problems, would you want to know before it was too late? Most men assume changes in sexual performance are simply part of getting older. But after helping men improve their health for more than 15 years, I can tell you that's only part of the story. I'm Dr. Leah, a urologist with over 15 years of experience, and today I'm going to walk you through 10 common mistakes that many men make without realizing the harm they're causing. More importantly, I'll show you what to do instead to help protect your circulation, confidence, and long-term sexual health. Before we begin, please subscribe to the channel, give this video a like, and tell me in the comments where you're watching from. I enjoy hearing from men around the world who are taking their health seriously. Let's begin with something many men overlook. Your penis often acts as an early warning system for your entire body. Because the blood vessels supplying it are so small, problems with circulation usually appear there before they show up elsewhere. If your erections become weaker, less frequent, or less reliable, don't simply blame age. Those changes may be your body's way of telling you that your blood vessels, hormone balance, or even your heart need attention. Listening to those early signals gives you the opportunity to protect not only your sexual health, but your overall well-being before a much bigger problem develops. The second mistake I want every man to avoid is experimenting with unsafe home treatments. Over the years, I've met men who were willing to try almost anything they found online in the hope of improving their erections. Some applied harsh household products to sensitive skin. Others used homemade stretching devices or tight objects that were never designed for the body. Unfortunately, many of them ended up causing far more harm than good. Biologically, the tissues of the penis are delicate and depend on healthy nerves, blood vessels, and elastic fibers to function properly. Excessive pressure, harsh chemicals, or unsafe devices can cause tiny tears, damage nerve endings, reduce blood flow, and leave scar tissue behind. Once that damage occurs, recovery may take months, and in some cases, it may not fully reverse. Emotionally, these injuries often leave men feeling embarrassed, frightened, and reluctant to seek medical care. Many wait too long because they hope the problem will simply disappear on its own. The safest approach is also the simplest. If you choose to use products designed to support sexual health, make sure they are medically approved and used exactly as instructed. Never improvise with household objects or follow risky advice from social media. Protecting your body is far more important than chasing quick results. Remember, healthy sexual function isn't built through shortcuts. It's preserved by making smart decisions that keep your blood vessels, nerves, and tissues safe for years to come. The third mistake is surprisingly simple, yet it's one of the most common problems I see in my practice: neglecting proper hygiene. Many men assume this isn't something worth thinking about, but healthy skin plays an important role in comfort, confidence, and long-term sexual health. Biologically, if you're uncircumcised, the area beneath the foreskin naturally collects moisture, dead skin cells, and oils. Without regular cleaning, this buildup can create an environment where bacteria and yeast multiply more easily, increasing the risk of irritation, inflammation, unpleasant odor, and infection. At the same time, there's another mistake many men make. Washing too aggressively with harsh soaps or heavily scented products strips away the skin's natural protective barrier, leaving the delicate tissue dry, irritated, and more vulnerable to damage. Emotionally, these problems often affect more than physical comfort. Men may become self-conscious about intimacy, avoid close relationships, or worry unnecessarily about their sexual health. The solution is straightforward. Wash the area gently with warm water and a mild cleanser during your normal shower. If you're uncircumcised, carefully retract the foreskin, clean underneath, rinse thoroughly, and gently dry the area before replacing the foreskin. Healthy hygiene doesn't require expensive products or complicated routines. Consistent, gentle care is enough to protect the skin, reduce the risk of infection, and help you stay comfortable and confident. Looking after this small daily habit can prevent much bigger problems later in life. The fourth mistake is one you should never ignore because your body is trying to get your attention. Pain, bleeding, unusual lumps, sores, or sudden changes involving your penis are never something to dismiss as normal. Many men convince themselves the discomfort will disappear with time, but delaying medical care can allow a small problem to become much more serious. Biologically, symptoms like these may be signs of infection, inflammation, urinary tract problems, kidney stones, scar tissue, or, in uncommon cases, cancer. Your body produces these warning signs for a reason. Ignoring them doesn't solve the underlying problem. It simply delays diagnosis and treatment while allowing damage to progress. Emotionally, many men avoid seeing a doctor because they feel embarrassed or fear hearing bad news. Unfortunately, that fear often creates unnecessary stress and allows symptoms to worsen. The earlier most conditions are identified, the easier they are to manage and the better the long-term outcome usually is. The practical advice is simple. If you notice persistent pain, blood in your urine or semen, an unexplained lump, a sore that won't heal, or any other unusual change, arrange a medical evaluation as soon as possible. Don't let embarrassment stand between you and your health. And if you ever feel dismissed or judged during a consultation, remember that you have every right to seek another healthcare professional who listens carefully and treats you with respect. Early action protects both your health and your peace of mind. The fifth mistake is taking unnecessary risks during intimacy. Many men think confidence alone is enough, but protecting your body is just as important as enjoying the moment. Some of the most serious injuries I treat happen because men ignore pain, rush the experience, or underestimate how easily an erection can be injured. Biologically, an erect penis is filled with blood and supported by a tough outer layer of tissue. If it bends suddenly or forcefully during sexual activity, that tissue can tear, causing a condition commonly known as a penile fracture. Men often describe hearing or feeling a sudden pop, followed by immediate pain, swelling, bruising, and the rapid loss of their erection. This is a true medical emergency that requires immediate treatment to reduce the risk of permanent complications. Another factor many couples overlook is lubrication. Insufficient lubrication increases friction, placing extra stress on the skin and deeper tissues. This can lead to irritation, discomfort, or small injuries for both partners. Dryness may occur for many reasons, including medications, hormonal changes, or stress, and it shouldn't be viewed as a sign that your partner isn't interested. The practical solution is simple. Take your time, communicate openly, and never force uncomfortable movements. When needed, use a high-quality, body-safe lubricant to reduce friction and improve comfort. Protecting your body today helps preserve healthy function, confidence, and enjoyable intimacy for many years to come. The sixth mistake many men make is exposing their testicles to too much heat without realizing the long-term effects. Your testicles aren't located outside your body by accident. They're designed to stay slightly cooler than your core body temperature because that's the environment they need to produce healthy sperm and support normal testosterone production. Biologically, repeated exposure to excessive heat can interfere with these natural processes. Spending long periods in hot tubs, placing a laptop directly on your lap, or keeping heat-generating devices close to the groin for hours every day may gradually raise the temperature around the testicles. Over time, this may affect sperm quality and create a less favorable environment for healthy hormone production. Emotionally, many men don't connect these everyday habits with changes in their energy, fertility, or overall well-being. They assume declining performance is simply part of aging when, in reality, small lifestyle adjustments may help protect their reproductive health. Fortunately, the solution is simple. Use a desk instead of balancing a laptop on your lap for extended periods. Limit prolonged exposure to very hot baths or hot tubs, especially if you're trying to preserve fertility. Keep your phone in a jacket pocket or bag whenever possible instead of your front trouser pocket. These may seem like minor changes, but over the years, they help create a healthier environment for your testicles to continue supporting testosterone production, fertility, and long-term men's health. The seventh mistake is one that's becoming increasingly common, especially with the amount of online content available today. Using excessive pressure during masturbation can gradually reduce your natural sensitivity without you even realizing it. Many men think they're simply doing what feels good, but over time, that habit can train the body to respond only to very intense stimulation. Biologically, your nervous system adapts to repeated patterns. If you consistently use an unusually tight grip, very fast movements, or excessive force, your brain begins to expect that level of stimulation before it can trigger a full sexual response. As a result, intimacy with a partner may begin to feel less stimulating. Erections may become more difficult to maintain, or ejaculation may take much longer than before. This isn't because your body is permanently damaged. It's because your brain and nerves have learned a pattern that no longer reflects natural intimacy. Emotionally, this often leaves men confused and discouraged. They may blame themselves, worry about their relationship, or assume they're developing erectile dysfunction when the real issue is simply conditioning. The practical solution is encouraging. Slow your pace, reduce your grip pressure, and use a quality lubricant to minimize unnecessary friction. Give your nervous system time to reconnect with lighter, more natural sensations. With consistency and patience, many men notice their sensitivity gradually returning, allowing them to enjoy healthier sexual experiences both alone and with a partner. The eighth mistake is one that affects far more than your erections. Smoking is one of the fastest ways to damage the blood vessels responsible for healthy sexual function. Many men associate smoking with lung disease, but few realize how dramatically it can affect their circulation long before breathing problems ever appear. Biologically, nicotine and the harmful chemicals found in cigarette smoke injure the inner lining of your blood vessels. As this damage builds over time, your body produces less nitric oxide, the natural molecule that allows arteries to relax and deliver the blood needed for a firm erection. Reduced blood flow doesn't just affect your penis, it also increases the risk of heart disease, stroke, and serious urinary tract conditions, including certain cancers that urologists diagnose every year. Emotionally, the effects often appear gradually. Men begin noticing weaker erections, reduced stamina, and declining confidence, but many never connect those changes to smoking. Instead, they blame aging while the real cause continues damaging their vascular system every day. The good news is that your body has an incredible ability to recover. Quitting smoking allows your blood vessels to begin healing, improves circulation, and supports healthier nitric oxide production. The sooner you stop, the greater the opportunity to protect both your sexual health and your overall well-being. If you're struggling to quit, don't try to fight it alone. Speak with your healthcare provider and use the support available. One decision today could protect your health for decades to come. The ninth mistake has nothing to do with your body at first. It begins with the way you think about yourself. Too many men judge their entire sense of masculinity by what happens during one sexual experience. When an erection isn't as strong as expected, they immediately assume something is seriously wrong. That mindset alone can become one of the biggest obstacles to healthy sexual function. Biologically, stress and anxiety activate your body's fight or flight response. When that happens, your brain releases stress hormones that tighten blood vessels and reduce the blood flow needed for an erection. Instead of allowing your body to relax, your nervous system prepares for danger, making healthy sexual performance much more difficult. The more you worry, the more likely the problem becomes. Emotionally, this creates a frustrating cycle. One disappointing experience leads to fear. Fear leads to anxiety. Anxiety leads to another disappointing experience. Before long, many men begin avoiding intimacy altogether because they're afraid of repeating the same situation. The practical solution starts with changing your perspective. Every man experiences occasional changes in sexual performance. One difficult moment does not define your health, your relationship, or your value as a person. Speak openly with your partner, reduce unnecessary pressure, and don't hesitate to discuss persistent concerns with a healthcare professional. When you remove fear from the equation, you give your body a much better chance to respond naturally. Confidence grows when you treat yourself with patience instead of criticism. The final mistake is one many men underestimate because it isn't about avoiding something. It's about stopping erections altogether. Your body follows a simple principle. Systems that stay active tend to remain healthier. Erections aren't only important for intimacy, they also deliver oxygen-rich blood that nourishes the tissues, maintains elasticity, and supports the nerves responsible for healthy function. Biologically, regular erections, whether during sleep, intimacy with a partner, or healthy self-stimulation, help keep penile penile tissue supplied with oxygen and healthy circulation. When erections become very infrequent for long periods, blood flow decreases, tissue flexibility may gradually decline, and sensitivity can slowly fade. This is why many specialists describe erectile activity as a natural part of maintaining long-term penile health rather than simply a response to sexual desire. So what should you do moving forward? Focus on the foundations that support healthy circulation. Stay physically active, eat a balanced diet rich in heart-friendly foods, sleep 7 to 8 hours each night, manage daily stress, and speak with your doctor if you notice persistent symptoms of low testosterone or erectile dysfunction. Some men also benefit from naturally occurring compounds such as L-citrulline, found in foods like watermelon, which your body converts into nitric oxide to help support healthy blood flow. I'm Dr. Leah, a urologist with over 15 years of experience, and I want you to remember this. Erection problems are not a reason to feel embarrassed. They're often an early signal that your body needs attention. Listen to those signals instead of ignoring them. If this video has helped you, please subscribe to the channel, give it a like, and share it with another man who deserves this information. I'd also love to hear from you in the comments. Which of these 10 habits are you going to change first? Small improvements made consistently can protect not only your sexual health, but also your confidence, your heart, and your quality of life for many years ahead.